So what we're going to be making our video on today is how to do a finger stick glucose. I have prepared for you guys a little PowerPoint with some reference tips on why blood glucose is tested and the types of instruments that are available to do the blood sugar testing. Most people with the diagnosis of diabetes are ordered to test their blood sugar a few times a day, and either they take an oral hypoglycemic or they will take insulin injections. Today I posted a video on the CareTouch glucometer, and what we have here is the little kit, zips open, has the finger stick lancet holder, it has the test strips, and it has the little glucometer machine. I added here alcohol wipes. It's most common to use an alcohol wipe when you are testing. You can wipe the area, allow it to air dry. Some people will have a cotton ball or a Band-Aid because if they're on a blood thinner or an antiplatelet medication, it may make them bleed with just having a little teeny finger stick, and you may have to sop up some blood with that. We keep our glucometer machine in a little kit, keeps it clean, keeps it organized. We have additional lancets, and we have another 50 count box of test strips. The video does mention checking the lot and expiration date to make sure that they're actually good and they're not expired. Okay, so to begin, we would talk about the lancet. This here is your CareTouch. Now what it does is it has a protective cover over it. You'd have your lancet here. It's like the little finger pricker. You would put it in here, okay, and you would twist this off, and it exposes a little tiny needle on the end. And you would put this back together, pull the tension on it to set it, and you can actually hear how it actually loads. So I just reloaded it. That is all ready. Get my alcohol wipe ready. Just wipe my finger. Now here is the little glucometer. Turning it on, it has memory. It shows a blood glucose of 118, okay? And here's our test strips. We're gonna test for the expiration date, which is fine, and open one up. Take out one test strip. It actually has an arrow that tells you which way to insert it. Now, when you put the test strip in, it flashes to A01 and you see a drop of blood over here. Okay, so again, I alcohol wiped, I loaded this. Now I would just simply prick my finger, squeeze, just barely touch to here, load with blood, and it is 118, okay? This has already been set with the date and the time as well. You can change that. It does hold memory. Just make sure that you dry up or sop up the rest of the blood over here in the back, just like they mentioned. You can eject the blood strip out of there, okay? In between patients, what you would do is you would be washing, cleaning with an alcohol wipe, putting that back in, closing everything up, putting it back together. You can keep your extra lancets here, okay? Now, in between patients, you're not going to use, obviously, the same lancet, but this is also set up for multiple use. And if you take a look at the dial in person, in class I will show you, you can see that you can record how many times that you've used this lancet. It goes from 0 all the way up to 10, and then it would suggest getting rid of it and throwing it out, because you can reload the spring tension on it and redo it again. Okay, so that's basically how to do a finger stick blood sugar. At this point, I would record what the blood sugar was. 118 is a bit on the high side, but about an hour ago, I just had some mango, so that is about accurate for like a 1 hour postprandial. You clean up everything else, record your data, and that's the end of it. Okay, thank you.